Understanding Autism Spectrum Disorder. Causes, signs, symptoms, and treatment. Autism Spectrum Disorder, ASD, is a neurodevelopmental condition characterized by challenges in social interaction, communication, and restricted, repetitive behaviors. ASD encompasses a wide range of abilities and symptoms, and each person with autism may have a unique profile. Here's an in-depth look at the causes, signs, symptoms, and treatment options for ASD. Causes of Autism Spectrum Disorder. 1. Genetic factors. Family history. ASD tends to run in families, suggesting a genetic component. Genetic mutations. Variations or mutations in certain genes are associated with ASD. Genetic syndromes. Conditions like Fragile X syndrome and Rett syndrome increase the risk of autism. 2. Neurobiological factors. Brain development. Abnormalities in brain development, particularly in regions related to social behavior and communication. Neurotransmitter imbalances. Differences in brain chemicals that influence communication between neurons. 3. Environmental factors. Prenatal factors. Maternal infections. Exposure to certain medications or chemicals during pregnancy. Birth complications. Premature birth, low birth weight, and complications during delivery. 4. Parental factors. Advanced parental age. Older parental age at the time of conception is associated with a higher risk of ASD. 5. Combination of factors. Gene-environment interaction. A combination of genetic predisposition and environmental influences. Signs and symptoms. 1. Social interaction. Difficulty with eye contact. Avoidance or limited eye contact. Challenges in understanding social cues. Difficulty interpreting facial expressions, body language, and social cues. Limited social reciprocity. Lack of typical back-and-forth conversation or shared interests. Difficulty in forming friendships. Challenges in developing and maintaining peer relationships. 2. Communication. Delayed speech and language skills. Late development of spoken language or not speaking at all. Repetitive language. Repeating words or phrases. Echolalia. Difficulty with conversation. Trouble starting or sustaining conversations. Unusual tone of voice. Monotone or sing-song voice. 3. Behavioral patterns. Repetitive movements. Hand flapping, rocking, or spinning. Strict routines. Rigid adherence to routines and resistance to change. Restricted interests. Intense focus on specific topics or objects. Sensory sensitivities. Over or under reactivity to sensory input. Lights, sounds, textures. 4. Cognitive and motor skills. Varied intellectual abilities. Ranges from intellectual disability to above-average intelligence. Motor coordination. Challenges in fine and gross motor skills, clumsiness. 5. Other signs. Unusual play. Prefers solitary play or uses toys in unconventional ways. Emotional regulation. Difficulty managing emotions, leading to meltdowns or outbursts. Treatment. 1. Behavioral therapy. Applied behavior analysis, ABA, a structured approach that reinforces positive behaviors and reduces unwanted behaviors. Early intensive behavioral intervention, EIBI, targeted therapy for young children to improve cognitive, social, and language skills. Pivotal response treatment, PRT, focuses on key areas like motivation and response to multiple cues. 2. Educational support. Individualized education plans, IEPs, customized educational strategies to meet the child's specific needs. Special education services, tailored teaching methods and resources to support learning. 3. Speech and language therapy. Speech therapy, to improve communication skills, both verbal and nonverbal. Social skills training, helps individuals understand and practice social interactions. 4. Occupational therapy. Sensory integration therapy, helps manage sensory sensitivities. Daily living skills, focuses on improving fine motor skills and independence in daily activities. 5. Medications. Medication for co-occurring conditions, such as anxiety, ADHD, or sleep disturbances, but no medication specifically for core autism symptoms. 6. Family support and education. Parent training, educates parents on strategies to support their child's development. Support groups, provides a network for sharing experiences and resources. 7. Alternative and complementary therapies, dietary interventions, Some families explore special diets or supplements, though scientific support is limited. Assistive technology. Devices and apps that aid communication and learning. Autism Spectrum Disorder, ASD, is a complex and multifaceted condition with a wide range of symptoms and abilities. Understanding the causes, recognizing the signs and symptoms, and exploring various treatment options can help individuals with autism and their families navigate the challenges and opportunities associated with ASD. Early intervention and a tailored approach to therapy and education are crucial for supporting individuals with autism to reach their full potential.